Hey guys, it's Robert, registered massage therapist and instructor of ligamentous articular strain technique. I've got a huge treat for you guys today. I've got a pre and post comparison from a friend of mine who is a massage therapist from Northern British Columbia. She is about 5 months post talar dome fracture. She had been walking down the stairs. She had fully plantar flexed, and the talar dome fracture went undiagnosed for about the 5 months. She only got the recent diagnosis within the last few weeks. It's completely healed, but the only treatment that she had during that time was from herself, where she put her foot into a removable boot air cast in order to keep it in a neutral position. So she's had no treatment leading up to my very first encounter with her. I didn't get the gait analysis on video, and I didn't get the range of motion on video, but her gait was completely off. She was externally rotating, and she was excessively supinating with her left foot. The range of motion, anytime that she went into almost a 90-degree dorsiflexion, she felt immediate pain where it felt like the talus was actually contacting the anterior aspect of the distal tibia and fibula. So I really hope that you guys enjoy this video. It's a video from both days. You get a pre and a post assessment immediately after treatment, where my only goal for the treatment was to actually get that talus as neutral as possible, get it seated back into its proper position in that mortise joint, and to stop it from supinating. Immediately after my manual treatment, which was about 20 minutes to half an hour on the Tuesday, she was fortunate enough that the naturopath in our office who performs prolotherapy treatments was able to give her some prolotherapy. We gave her some rock tape. We taped the ankle to continue the balance, coordination, kinesthetic awareness retraining for about 72 hours. And then I saw her again on the Friday, and we did a pre and post treatment assessment. There was no prolotherapy after the treatment, but I want you guys to get a sense of the amazing possibility that you guys have in your treatments to improve a patient's quality of life. This was a patient who was suffering in pain. The discomfort was keeping her up all night long. She had to change her sleeping habits so that she slept with her foot hanging over the edge so that it stayed in a dorsiflex sort of position, because anytime it went to plantar flexion, it would just cause that pain result. And it was just it's a huge ability that we have as manual therapists to make a huge improvement in the quality of life of our patients. So both treatments on the Tuesday and the Friday, they were only 20 minutes to 30 minutes long. It was predominantly ligamentous articular strain techniques. The only techniques were those that I used in order to get the talus into more of a neutral position. These techniques are fully covered in my online course for the leg and the foot. They're covered in the live courses that I teach. So when I give you guys all that information in the online course and the live courses, it's the exact same information that I used with Wendy in these treatment techniques. So enjoy the video, and I will see you immediately afterwards. Thanks, guys. So here we have a left ankle. How many months are we now? 6 months post full plantar flexion, mortise joint disarticulation, anterolateral third degree sprain strain. We haven't done any manual therapy to the foot yet, so this is a pre-treatment assessment. So what I'm going to get Wendy, to do is let's go standing on the affected left leg, holding onto the chair with your eyes open, and then you are going to let go of the chair, and there's not a lot of stability in those tissues. Okay.
With my eyes open, right?
So the eyes are open, yeah. Okay, so let's have you just put both feet on the floor again, nice and stable. Okay, and let's get stable on that left leg again. And holding onto the chair, and eyes closed, and then letting go of the chair, and that's completely unstable also. Okay.
Now you're making fun.
So we are going to primarily do some ligamentous articular strain techniques only to try and improve some functionality to those tissues and to the nervous system, and try and get that talus to be in a neutral position. And we will do a post-treatment assessment right afterwards. Immediately post-treatment, and the primary goal for the last 20 minutes was to position the left talus into a neutral position, so it was talus neutral, and that it wasn't supinated or pronated. So we haven't done any balancing or coordination. What we have noticed is that immediately after treatment, and actually during treatment, vasculature became very present into the foot where we couldn't see it beforehand. Initially, just standing on the 2 feet right now, what are your sensations?
I can feel my toes hit the ground. That's weird.
Feel the toes hit the ground.
Like I can feel my foot hitting. It feels like there's a lump in the floor, but it's not. There's no lump in the floor.
Okay.
That makes sense.
Let's get you to walk back slowly to
Backwards?
the chair.
Oh,
No,
more
to
to
the
the
to the chair. Let's go to the chair.
Oh, that is weird. I can feel the bones in my feet.
Okay.
It feels like you have lumpy floor.
Okay.
Like I can feel my bones hitting the floor. That's
Okay.
cool. Okay.
Okay, so holding onto the chair,
Holding on to the chair.
eyes open,
Yep.
standing on the left leg. Okay, and then and then when you feel comfortable, you can let go of the chair.
Look at me.
Immediately post-treatment.
Look at me.
Starting to fight a little bit. Far more balance.
Look at me.
Okay, and then let's go back down to both feet on the ground. Okay, take a little breath, deep breath. All right. So here's the test. So holding onto the chair again, standing on the affected leg, eyes closed, and then when you're comfortable, letting go. A little bit more stability, but still unstable. Okay, so that is immediately post-treatment, where the only thing that we did was do some very specific ligamentous articular strain techniques to get that talus neutral, and that is it for today. Okay, so we are between 48 and 72 hours post-treatment. Now, with Wendy, with her left foot, after we got the talus neutral, she also had prolotherapy, injection into the anterior and lateral aspect of the talus, and we also did some rock tape in order to provide some balance, coordination, kinesthetic awareness that lasted until about the last day or so. So, post manual therapy and post prolotherapy, what have you noticed as far as change with that left foot?
It feels more planted on the ground. I feel a bit more pain, but I think because I'm moving it better.
Okay.
I'm more conscious of being on it as opposed to trying to not be on it.
Okay. Do you feel that you have more weight on that?
Oh yeah. Yeah, and
Okay.
I think that's part of it
You
because
can
now
stabilize more.
Because now that I'm standing here, I feel like both my feet are hitting the ground a bit more equally instead of this.
Instead of protecting.
Yeah.
And what was it that you said about the floor?
That the floor feels lumpy.
The floor feels lumpy.
The floor feels lumpy.
So we've determined that the floor feeling lumpy is Wendy's ability to actually have sensation through her metatarsophalangeal joints now.
Yeah.
Yeah. We also noticed that when you were, we should have got it on video, when you were doing a gait, that your foot also externally rotated and that you weren't planning on the calcaneus.
Yeah.
But you're also finding that you didn't have any sense of awareness for position to plant.
Yeah, I have to be really conscious of being, having my feet right in front of me instead of externally rotating every time. So I find now that when I do step forward one foot in front of the other, my foot still does a little shaky shake to plant.
Okay.
Okay. Retest.
So let's put it through the test a little bit today.
Okay.
So let's do the same as we did last time. So let's have the hand on the chair, and then standing on the bad leg, standing on the left leg, and then we're just leaving the eyes open.
Okay.
And you can take the hand off the chair.
Oh, look at that.
Wow, that's pretty stable.
That's pretty good, eh?
That's pretty good.
Look at me.
Okay, and then hand back on the chair, back on the ground. Okay, deep breath. All right, and hand on the chair, standing on the left leg, and eyes closed.
Ooh, good. Okay.
Okay.
That's better. Is it not better?
That looks better to me, but we'll do a side-by-side comparison with the video, just to confirm. Already that, to me, from my memory, that looks a lot better than before. Okay, so we'll do another round of manual therapy to the talus, getting the talus neutral, maybe a couple other things, and then no prolo today, but we'll get it taped, and then we will redo this post-treatment and see what the differences are. Focus. Okay, so we are immediately 20 seconds post manual therapy treatment, where my focus was to assess and maintain the talus being in neutral and work on a little bit of the plantar fascial tissues, because while we were working with the talus, assessing it and maintaining it in a neutral position, Wendy had commented that there was a burning sensation and through the plantar fascial tissues. So we worked a bit with that. We did some stretching for the Achilles and the posterior compartment. But in my opinion, working with the foot today, the foot was a lot less swollen. The talus was more in position than it was previously. It was very easy to find the distal end of the tibia, and the talus had still felt like it was seated in place from where we left it previously. So let's redo the test. So hand on the chair, standing on the left leg, eyes open, and then letting go. And what are you feeling with this compared to what we did beforehand?
I feel nothing laterally.
Whereas beforehand?
There was like pressure like all the way down to the floor.
Okay.
Nothing laterally.
All right, let's go back onto both feet. Deep breath. And hand the chair, eyes closed.
Oh. Okay. Maybe I'm just not very good at this.
Oh, you're doing pretty good. We'll do a comparison before and afterwards.
Oh.
Okay, so any description or sensation or change that you want to describe from Tuesday when we first did this, comparing it to now?
Oh, Tuesday, it hurt all the way along here when I stood on it. Like there was no, you couldn't, it was hard to distinguish where it was coming from because the whole thing hurt. Now, and when I did it before the treatment just now, there was lots of pressure straight down this way. Now it's a little bit there. And I feel like my toes can claw the floor a bit more. Like
Okay.
when I'm doing this, like I feel like I can.
You got more engagement?
Yeah, lumpy floor.
Okay.
Yeah.
Any other comments
Um,
before you head back up north?
Can I come back? No, I don't know. Give me the day.
You had said that sleep was different
Oh.
for you also.
Yeah, before I used to have to sleep with my foot hanging off the bed so I could keep it dorsiflexed. Now I can have it on the bed as long as, like if I'm lying on my side, I can have it plantar flex slightly or just in neutral. But I used to have it like right at 90 degrees, like hanging off the bed, sleeping on my stomach.
Because it felt...
Because the weight of the blanket, I think, was pushing it down too far, and it was so painful. Like it would wake me up.
Okay.
If I wiggled my way up, it would wake me up.
Okay. Was it waking you up at night before
Yeah.
before I saw you on Tuesday?
Yeah.
Okay. And how's your sleep been since then?
Oh no, I sleep through the night.
Nice.
I know, it is good.
All right, so there we go.
Thanks.
Okay guys, welcome back. Thanks for watching that video. I really do appreciate the time that you guys are taking out of your life to watch the video. I really hope you guys get a sense of the impact into the quality of life that you can have as a therapist with your patients. You know, with Wendy, she hadn't had any treatment leading up to when I saw her on the Tuesday. You know, the foot was completely unstable. She had no balance coordination or kinesthetic awareness. Her gait was completely off. The talus was forwards. She was supinating every time she walked, and her hip was externally rotated, the knee was externally rotating, and the foot just had no idea where it was planting with the gait. Getting that talus neutral was my primary focus, my primary directive with both of those treatments. You know, a 20-minute treatment, getting the talus neutral, getting it from not supinate or from over supinating to being in more of a neutral position, and re-educating the balance and coordination is just an amazing experience, not just for us as therapists, but for the patient. It makes a huge quality of life. And that's what I want you guys to realize, is that when you utilize techniques that target mechanoreceptors, which are at the ligamental periosteal junction or the tenoperiosteal junction, you get longer lasting effects and you get faster results. And that's exactly what I want for you guys. That's why I created the online courses, so that I can have more of an impact with more people through you guys. There's a link down below under this video for you to register for the online course for the leg and the foot. I really do encourage you guys to jump at that opportunity to start incorporating these techniques into your amazing practices already, so that you can amplify the effect that you have with your patients. So once again, I really hope that you enjoyed that video. Again, watch it over and over again. It's an absolutely amazing experience. It was fantastic to see Wendy and to have the opportunity to work on her foot both days. And I really do hope that she comes back. When she does, I will post another video of post-treatment and an update. So again, thanks a lot for watching. I really do hope you guys appreciate, again, the impact you can have with your patients. Take the opportunity, register for the online course for the leg and the foot, and contact me with any questions that you've got. And again, thanks a lot for watching, and hope to see you guys out there. Thanks, guys.